for emotional stress and mental health stability for frontline health workers during this COVID-19 pandemic. A flight surgeon and host, Dr. Dayo Osholowu, joins me on the news. Good to have you, Dayo, this hour. There is no doubt when we say that we cannot even begin to imagine how stressed health workers are now. I mean, it's like a medical war zone for them. How do they keep stable at this time?
Thank you for having me. Actually, it's a especially difficult time, but I have to say that the health workers in Nigeria are strong because healthcare has been in a crisis before COVID-19, and many families are affected, especially now because there is a heightened concern about infectivity. So wives, children are also concerned, husbands for their family. So the emotional status of doctors, nurses, and other health workers is especially challenged at this time on the home front and also on the new war front for COVID-19.
So there is no doubt that the mental health impact of this, it's going to last longer than the physical health impact. How do we begin to brace up for that, especially medical workers? How do they begin to brace up for that?
Well, I think the word to describe it would be post-traumatic stress. So we know that today we have 174 cases, but by the trajectory of COVID-19 in other countries, in America over 200,000, in Europe over 100,000 cases, we should brace for a larger number of cases in Nigeria. And stress affects the emotions, stress affects the body, and stress affects the brain. So there have to be preparations for reducing working hours. There have to be preparations for psychological support for health professionals. And also there has to be, support for to keep body and soul together, so to say. There have to be incentives for compensation for the health professionals so that they, in these difficult times, would be able to also shop for their families, provide food and medicines for those close to them.
Absolutely. These medical workers also, or health workers also belong to a family, and sometimes some things are expected of them. So if you're a family member at this time, how should you, or a friend or a colleague, how should you help? How should you support them?
I think the first thing is there's a shortage of protective personal equipment. So any friends and family who are able to acquire, yesterday, a friend of mine, her husband donated 50 personal protective equipment to our hospital. So this will be the first step for all Nigerians if they can get their hands on any personal protective equipment, gloves, face masks, surgical gowns, and donate to these health professionals to make sure that they don't contact the infection. As we know in other countries, doctors have been infected and doctors have died, also Nigerian doctors. So the first thing is to make sure that there are no infections of doctors. Thank God we haven't yet had any infections. The other thing is that the government should also support testing of doctors and other health professionals to ensure that while they're in the workplace, they are also being surveilled. And the other thing is to just call them, speak to them, even though they're at work, look for times to call them when they are off shift to, ask how they're doing, ask how things are. It's especially a difficult time and it's going to get tougher.
Dayo, let's just say that we do appreciate you all for the work you're doing. You're indeed heroes. Please stay